Hi, thanks for jumping on Rehab and Revive's channel to discuss your knee replacement recovery. So you needed a knee replacement because you got arthritic buildup and arthritic changes that made your knee big and stiff and hard to move, hard to go upstairs and just live your daily life. Now, knee replacement is rated the #1 most painful thing in all of surgery. The recovery is so painful. So let's make your life a lot easier. Now, I believe personally that the knee replacement needs about 20 or 30 more years to improve. But hey, you can't change that. So what we want to do is get you more weight bearing, because oftentimes you're not trusting that leg anymore because you stopped using it years before you got the knee replacement. So what we want to do is go after things like your hips, if they're healthy. If they're starting to break down, then we got to go after your pelvis, get your rib cage, be able to disperse the stresses and improve that muscular capacity to absorb the shock that would go to your knees. Not only do we want to do that, we want to get your ankle moving better because that helps improve your stride. And when your stride improves, guess what? Things become more efficient. So we're happy to help you address your concerns at Rehab and Revive. Remember, we heal smarter, not harder.